Hello, I am Dr. Manish Garg. I am a pulmonologist and I am Associate Director with the Department of Pulmonology in Max Hospital, Dwarka, New Delhi. Tuberculosis is such a prevalent disease, specifically in India. We account for most of the patients all over the world for tuberculosis, and in high burden settings, active case finding is sometimes fruitful. Active case finding can be done in two ways. It can be a community based activity, or it can be a health facility based activity. In the community based activity, what we do is health workers, they go to the community and they keep questioning the people there, and whoever has symptoms suggestive of TB, they are then subjected to the initial basic screening investigations, and they come positive, then they are sent for specific investigations. And in the healthcare facility based active case finding, patients, those who are coming to the healthcare facility for any illness, any other illness, related illness, they are actively investigated and queried for symptoms of TB, and they are subjected to screening investigations. And it has been found that the active case finding, specifically in healthcare settings, is more fruitful and cost effective, and otherwise also more effective. In it, the a patient who comes to, there are different settings where it can be implemented, like in the facilities with nursing home facilities, old age patients are there in the crowded places, in the HIV clinics, in the patients with who are attending cancer chemotherapy clinics. These are the settings where the patients who are having symptoms, those can be suggestive of TB, they are screened and they are evaluated. Now in India, the patients, specifically for the patients of HIV, they are all screened for TB, and it's vice versa also. The patients with TB are all screened for HIV similarly. So the most effective way of active case finding is usually hospital-based setting and questionnaire-based, where a patient is questioned by a healthcare worker, and then he is subjected to, depending on the most there are different kind of TBs, but the most important for the from the community point of view is pulmonary TB. That is the TB affecting the lungs, which is liable for liable for spread in the community just by coughing, or just by breathing, and just by deep breathings and coughing in the close contacts. So pulmonary tuberculosis is screened by chest x-rays and sputum evaluation. So this is the best method and most effective method of active case finding in high burden countries. See, community health workers, they are the backbone of any health intervention that we do on the community basis in the society. They are the people, they are the persons, they are the backbones, and when they go to the people, they know, and they have those keen eyes and keen ears, so that they can find the patients, they can find the people out there in the community who may be the patients, who are the patients who don't even know that they are the patients. And then a healthcare worker is usually from the community, and he is acceptable and respected in the community. If someone says you are having TB, why would I accept? But the healthcare worker is the one who makes me realize that I may have TB and I should undergo investigations, and that would be helpful to me. And I will only listen once that person is respectable to me, that person is available to me, and who has a rapport with me. So healthcare workers, they are the backbone of any sort of community based intervention, where we want to find the patients, and we want to treat the illness, and we want to prevent the spread of the illness in the community as a large. The main challenges are in finding the healthcare manforce. As we discussed, they are the community-based healthcare workers who go to the community, and then they do the search, then they do the finding, and they subject them, they convince the patient and subject them to basic screening investigations. Now in the low resourced communities, the healthcare workers are already burdened with a lot of things and a lot of programs. Sometimes there are the low number of healthcare workers, community based workers, then it becomes difficult for the person who we think is a patient. The person is not thinking that he is a patient, but who we think, or the community based healthcare worker thinks he is a patient. Now he has to convince that patient that you have from the village level, you have to go to the district and get yourself investigated because I think that you have certain issues. But in the low resource facilities, in the low resource setting, it is such a difficult task to have first a health worker, then to have screening facilities, that is, even though it's cheap, the basic x-ray facilities and basic sputum investigation facilities. And furthermore, if required, in case for the pleural fluid, that we do ADAs and gene experts. Gene expert is now a standard method of diagnosing tuberculosis in a very time efficient way, in a very reliable way, but it's expensive. Then it's not available, it cannot be available just at the screening level. TB is an illness that is completely curable. Have faith, have confidence. TB is completely curable, and the government is putting in every effort, the medical community is putting in every effort to, I would say, eradicate it. Our target is to take it to that level that it stop being a threat to the community. So, and it is very much achievable. The drugs are good. The only thing is that you have to follow the regime. You have to take it for a certain time. Usually the 6 months is the desired time duration that we give TB medicines. There may be certain challenges, but then there are doctors, then there are healthcare workers, then there are hospitals which are available to you to, in case if you have any of the issues, health issues or availability issues or any other logistic issues. So government is very serious, health community is very serious, and it's completely curable thing, and it's not a taboo. Since it's a completely curable thing and you can get it from anywhere, you need not even ask how did I contract, or मैं कैसे TB patient हो सकता हूँ. It's not a question nowadays in the community. So it's completely curable, and have faith and be persistent with the therapy.